to just go ahead and get started just with the two of you at the moment, and hope that the rest of the people signed up join up in a little while. So the idea is we want to talk to you about the Viva cards, and I don't know how much information you've seen so far about the cards, but just if I could, Mary, from you, just gather a little bit of information. You guys are an ortho practice, and just Todd, so you know, I'm going to go ahead and just present this to Mary as if she was a one-on-one client, and we'll do it in a group format. If you have any specific questions, feel free to put them in the question box, and I'll kind of stop along the way and answer as best I can. And if you'd like to chime in and you can do that, you're more than welcome to as well. So, Mary, you guys have an orthodontic practice in New York, and how many patients do you typically see there in a month?
Well, we usually see patients about 13 days a month. Okay. And we see 70 to 80, sometimes more than that, patients a day.
Okay. Wow, that's a lot of people in a daytime.
It's a lot of people.
Okay, so that's, if I did my math right around 900 people per month that you'll see coming in and out the doors. And those are people who are spending money with you and seeing your customer service, etc. So that's great. How many new patients are you guys getting there in the practice currently per month?
I think our target is between 45 and 50 a month for new patient consults.
Okay. And are you meeting that target typically?
Most of the time, I will say yes.
Great.
Not every month, but most of the time.
Okay. And what are you using currently for how does a new patient find you right now?
Most often it's by general dentist referral.
Okay.
We also have our website with telehealth.
Okay.
And we do word of mouth. We do refer a friend. So if you're a patient, you refer someone, you can win a gift card or get a credit on your account.
Great.
So we try, and we also do some marketing through the internet and in the newspaper.
Okay. So now, if we were to pull your dentist aside and say, what is the best possible opportunity for me to create a new patient? What kind of new patient appointment would that be? What would he say?
You mean how to get them to find out about our office?
Yeah, like if we had a new patient coming in at a 2 o'clock appointment, what's our best case scenario? How did that appointment?
Okay. That best case scenario would be that they're like at the age to start full treatment, which would be around between 12 and 14.
Right.
And that and that the mom and dad would say, sure, let's go ahead and do it, and they get started right away.
Right, and typically when I ask practices across the country what their favorite kind of new patient opportunity, it's going to be word of mouth referral. What we have seen, and certainly the feedback that we're getting, is that those patients that have been referred are most likely to show up for their appointments and who are most likely to accept treatment on a higher percentage level. Does that work that way in your office?
Yeah, I would say so. Yeah.
Okay. And dentists have been working with word of mouth forever. As a matter of fact, every single dentist I've ever talked to, when I ask them what's their marketing strategy, word of mouth and referral is always top priority. So Viva cards actually take word of mouth and they create real effectiveness and trackability and everything to the campaign. So I'm going to show you a little bit what it is. Basically, it starts around a card, and the card itself is plastic and thick, just like as if I was to give you a Starbucks gift card for $20. If I gave you a $20 Starbucks card, what would you do with it?
Use it.
Yeah, you just like stick it in your purse, and next time you felt like having coffee, you would be able to pay for your coffee. So the idea is the card is special like that. It's that same kind of quality, if not more beautiful, quite frankly. There's lots of graphics that you can go ahead and put on the specially design the card for your practice, and we usually put an offer on the card as well. So depending on the practice and depending on their marketing campaigns already, sometimes that's centered around teeth whitening, sometimes it's centered around a specific dollar amount, It doesn't really matter what the offer is. Some work better than others, and as a matter of fact, teeth whitening gift card works exceptionally well for orthos just because we have found a way to actually raise money and put some dollars back into the community around those 12 to 14-year-old kids that will help get you some great leverage for community goodwill and also new patients. So, but we can talk about that in a little bit. So you're basically going to pick your offer, and I'm going to split screens here and show you kind of just what a card looks like 3D. This is a, you see West Side Center here on my screen now?
Yeah.
Okay, so this is a card, and you can see this area over here is clear. They've got the offer on the front, and then how to find the practice, any kind of expiry dates, any kind of disclaimers or anything like that on the back of the card. So you can see the quality of the card is quite nice. So I'm going to go ahead and bring this back. The idea is because the card is so nice and it feels like it has value, it doesn't get thrown out, and it does stay in the wallet, which is awesome. The other thing that I like about the card, though, is that it's easy for your patients to share on your behalf. Even having been in marketing for a long time myself, I had a friend who opened a restaurant up in the last year or so here, and she asked me to hand out these flyers, which were all discount coupons and stuff, and of course I handed them out for her. She's a good friend of mine, and I was helping her with the restaurant. But what I found was every time I was handing out a flyer, I kind of felt like I was selling something, and it's a little bit uncomfortable. Now, if I had had these Viva cards, which we didn't have at the time, but if I had had an opportunity like this to have a gift card of $10 off dinner, it would be easy for me to hand these out because it's like I'm giving presents to everybody instead of selling them something. So you'll find that your patients feel the same way. It's very easy to give a friend and family a gift card on behalf of the dentist rather than some kind of even just a discount coupon or referral card or anything like that. Make sense?
It does, yeah.
Okay. I think that's one of the biggest components of this, is it's just so easy for the patients to share on your behalf. So the idea is to distribute as many cards as possible. And so there's some protocol. The first thing you're going to want to do is give the patients that are coming to see you each month 2 gift cards as they're checking out from your practice. So you're just going to give the gift cards on behalf of, thank you for your business. We appreciate it. Here's some gift cards to distribute to your friends and family. At your leisure, we appreciate it. And you give that to them, and they can go ahead and distribute them to all of those word-of-mouth people that you're looking for already. The other thing is for distribution that your staff gets involved. And for the staff to get involved, that's the second best referral, because the people who are the most likely to have great things to say about your practice outside of your patients are the people who work there and the people who earn a living there. So there's lots of protocol behind getting the staff to actually distribute cards. And do you guys have any incentives already in place for staff members to refer new patients to the practice?
No.
Okay.
No.
Okay. Sometimes that exists, sometimes it doesn't, because it's a little bit hard to track sometimes. But it's always a nice gesture. Now, in your practice, a new patient probably represents a few $1,000s in revenue. Is that right?
If they start, yeah.
Yeah. And for you guys, is that 3,000 or 4,000 or?
Yeah, it could be anywhere between 3 and 5.
Okay. Okay. So for general practice, we usually use the average of about $500 per new patient. For your particular office, at $3,000 per new patient, it's going to be really easy for me to give a $10 bonus or a $20 bonus for a card that is brought into the office on behalf of the staff member if it's going to make me $3,000. That seems like an easy transaction to make. So, but the thing is, the cards are great to be distributed in other ways too. How long have you guys been in practice up there?
30 years.
30 years. Okay, so you obviously.
It's our 30th year.
That's amazing. Good for you. Congratulations.
Yes.
So obviously, you all have some great associations already. I'm sure there's other professionals who are recommending you. You had mentioned already that a lot of your business comes from some of the general practitioners in the area. So it's easy to refer back and forth between professionals, not necessarily just in dentistry. Sometimes the chiropractor down the street can refer you. And these cards can be used for those relationships. They can also be used in Facebook campaigns to get your Facebook up and running and making some good social networking there for the practice. You can distribute the cards through community groups. There's lots of different things that you can do. Charity campaigns, which is a great thing, which I love for this program, and I'll explain it to you a little bit at the end, just kind of as a sidebar if you help me remember. But being able to raise charity in your community, especially around any kind of children's foundation for your particular situation, that being an orthodontist, is a great situation to create some new patients. So it's very, very easy to do. But one of the things that I love the most is that these cards can actually be used to reach back out to your inactive patients. So there's plenty of patients in every practice who are just in the filing cabinets, who came in, got great service from you, and for whatever reason either didn't complete their treatment fully or didn't start the treatment that you started for them, that you recommended for them. And maybe that's a financial decision, maybe it's a timing situation. But in any case, every practice has those patients on file who have not activated their treatment. And these cards are a great way to get them kind of generating some money for the practice. For example, if I am someone who has, and I'll talk a little bit more general here for everyone else on the call, but if I have you know, something, maybe a crown I need done, but it was going to cost me $1,500 to get it done. So I'm like, okay, well, as soon as I get the money, I'll pull that together. And I don't go back, and I don't go back. But every time I'm drinking coffee or whatever, and I'm feeling the pain in my tooth, I'm still remembering I need to go back to the dentist, but I don't have my $1,500. Well, if all of a sudden in the mail I get this lovely gift card from my dentist for $100 off or $200 off, that might get me a little more activated, a little more quickly to get myself back in there and spend my money to get my treatment accomplished. So it's a great way to get your inactive patients out of the filing cabinet and back into your office. So between all of the different options that you have for distribution, there's some basic ones, obviously giving them to each of your patients as they check out and helping your staff. Those are the best recommendations and referrals that you can. You're going to be working with your consultant, in which case this for you, I think, is Gwen. Is that right?
Yeah.
Your marketing consultant. So she's actually great at all of this strategy of what kind of offers will work well for you, and also where you can put these cards and what people you can help distribute them and what different campaigns we can put together for you. So there's lots of ideas around that, and you have someone dedicated to looking at your specific practice and seeing how it will work the best for you. Now, the card itself is awesome, and the fact that it's a gift card is great. The fact that nobody throws it out is great. And the fact that it's easy to distribute as a patient is amazing. But what makes it amazing is that there's a magnetic strip on the back. And before the card is handed out, it's going to be swiped through this little swipe machine, which doesn't require any software whatsoever. It's really plug and play, very, very simple. And the strip actually tracks information. What staff member gave the card out, what patient it was giving to, when the card went out, when the card came back, and who redeemed the card. And that information is tracked on this online dashboard. And the dashboard collects all of the information and compiles it into some really amazing statistics that I'm actually going to show you if I can get my internet to pull up here. Okay, so with the, let me kind of walk you through. This is, I want to make sure I've got this live here because it's been sitting down for a second. This is actually the statistics for an office that has given us permission. There's a couple of offices here that have allowed us to show some statistics, but since I've talked about Glen Lake about 10 times today, I'm just going to go ahead and use the same information if you don't mind. The total section here, you can see there's internal and external. Internal is going to be the cards that are distributed to your patients and to your staff. So those are the cards that are going out on behalf of your staff referring you and your patients referring you. External would be the general practitioner office. Sorry, did we miss you?
Yes, I lost you. I was trying to put it on speaker, and I'm so sorry.
That's okay. That's okay.
I'm holding this on my iPhone. It's starting to hurt.
Well, I appreciate your effort, for real.
Which I don't. Okay, sorry.
Okay, so the external component here is going to be anyone that's actually maybe a business handing out cards on your behalf, or another professional that recommends you in the area, that kind of thing. So you can see the difference. And in this particular case with Glen Lake, they have so far, since they've started their campaign, distributed 4,447 cards. Now, as a result of that distribution, they have seen 237 people in their office to redeem the card. So that's a great percentage of response. I know for a lot of the direct mail campaigns, I just talked to an office right before this call, and they were spending $3,000 a month in direct mail, getting 5 patients off of that. And I'm like, is it okay that you're paying $600 for each patient that you bring in? So the percentage of response is wonderful. And of course, just as we mentioned at the beginning of this call, the internal, or the cards that you're giving to your patients and that your staff is giving out as referral cards, is always going to be really high response. You can see that it's over 6% in this case. So that makes total sense, because that's that word of mouth patient. So if you look at the charts here, you can see week by week how these are the cards that have been distributed, and above that are the cards that have been redeemed. When the program first starts, you'll see that there's more cards distributed than there are redeemed right at the very beginning, because just like I mentioned at the beginning, when I give you that Starbucks $20 gift card, it typically goes in your wallet until you need coffee. So it's not like you're rushing right to the Starbucks to spend the gift card. But it does, we can put an expiration date on it, and that does help a little bit in getting the cards activated quicker. But you'll see as time goes on, the two charts really do mirror each other. And the more cards that you go out, the more cards will come in. Now, as someone who has been running sales teams and marketing initiatives for a long time, this is where it gets very exciting for me. This chart shows you exactly who is loading and distributing the cards. So I can see here that Adya has distributed 144 cards. Anna is probably a front desk checkout person. She's distributed 549 cards. Greta, 122. But over here you can see also there's like business here, Lifetime, ABT, Costco. They have been given cards to distribute as well. So you're going to be able to see who is handing out cards on your behalf. But even better than that, you're actually going to be able to see whose cards are coming back in as a result of their behavior. And that's going to come on the chart above. So Adya has distributed 144 cards, but 9 of her cards have come in. And you can see the more cards that have been distributed, the more cards will come in. But what's lovely about this is if you do have, whoops, I'm trying to get my charts and organized here. There we go. If you do have staff incentives, you can actually pay the staff specifically to the exact person who, you know, the incentive itself, the card that actually came in and the number that came in. And if you're using this as a marketing tool with different professional relationships or businesses, you can also see who is actually participating and referring you, because if I'm sending out 100 cards to 4 different businesses, and 2 of the businesses get me 20% return and 2 of the businesses give me 0% return, then I know not to put cards in the 0% return people and find other people to give them to. So it's an amazing way to track where your marketing is actually coming from and who is actually participating in referring you, which is great. That makes a difference to you guys, would you say?
Yes, definitely.
Yeah, it's great to be able to track that. Now, I told you at the very beginning that there's a lot of information that you can get from the card on the magnetic strip. And this is actually the same office. Let me make sure this is real time again. And this is their statistics for August. So far in August, they've received in the office 26 cards. And if we look across here, let's look at number 21. Number 21 was actually activated on the 2nd of August at 9:25 at the office by Renate. And it's a program that's another company is referring them. So they obviously have this Très Bien Nails handing out cards on behalf of the practice. Now, this particular card came back in on the 17th of August, so that was a very quick return. That's wonderful. Sometimes it takes a couple of months for the cards to come back in. It tells you exactly what time. Came into the office. The offer on their card was free teeth whitening. And if you see me click this little star here, or this little plus sign, it tells me exactly what patient came in as a result of that card. So now I can run Rosa Sandler through my patient software and know exactly how much revenue was created from that specific card from Trey Bien Nails on that day, which is amazing tracking information. Then you can see exactly what dollars you're creating with your marketing programs. Now there's another piece of this that's kind of a new feature that's been wonderful, and it only does work in the States, so if I have any Canadian dentists on the line, please know that it's coming, but there's a little bit more process going for this particular piece. But you know how when you get a credit card, you have that sticker on it that says you have to call to activate your card, you have to call the 1-800 number?
Yeah.
Okay, so the same thing is happening here with these cards. There's actually a sticker on there that says to activate your card, text this number. And when the patient who has the card texts the number, an email goes directly to your front office that says, please call this number to set up an appointment within the next 24 hours. And when we have seen patients who have been given cards do that, and in this case for Glen Lake, 64 times have cards been activated, look at the response rate. Over 40% of those cards come into the office. So it's a great way to accelerate that response rate. So not only are you getting a great response rate from your referrals and from your outside sources, but when any of those people actually activate the card through that text system, excuse me, they get an extra, 40% of the time those people are showing up in your office, which is awesome. So let me just get back to my slides here. Now, we are talking about the patients coming into the office specifically, and they're coming in around a card. Sometimes it's around whitening, sometimes it's around $1 off amount, and there's a process for whatever the card is. But the idea is they are in your office, and they're coming in for treatment and a new patient exam based on your offer. So it's not like they're just calling the front desk and hoping, you get it scheduled. We have them tracked because of the magnetic swipe that they have appeared in your office. You can increase the response rate. We saw at Glen Lake it was over 5%. The text message activation, of course, increases that dramatically. If you are incentivizing your staff to get those cards in, of course, that's going to accelerate your response rate. And if you're monitoring those results that we were just looking at for your own practice real time on a regular basis, you're going to be able to see who's participating, who isn't, where to focus distributing cards, and where not to. Make sense?
Yeah.
Okay. So the whole question at the end of this whole process is really how many patients do you need? Something that I haven't talked about through the whole presentation is the fact that Viva cards are guaranteed. They are not guaranteed to give you new patients. That's up to you. But they are guaranteed to deliver patients into your office, potential patients. And it depends on the card amount that you purchase. But you can purchase cards in groups of 1,000, 3,000, or 6,000. When you get a Viva package, it comes with the magnetic card reader, which is the swiper that you need to put the information on the card. It comes with that online dashboard, which keeps up with that information live on behalf of your statistics for your staff and your practice. It comes with the text activation service, which is going to send you that email so you can go ahead and make the appointment and have that person come in to see you specifically. There's a little bit of system training that you need to go through, which only takes a few minutes. Basically, everything kind of plugs into the computer, you get up on the internet, and that's about it. Any technical support that you need is live. And then in your case, you have Gwen, who is your marketing consultant, who does your assessment about your practice and your specific needs in your community, and how we can best create distribution channels for you to get some good returns. In the moment, we're also adding some whitening product to any of these purchases. We've bumped it up so that if you were to retail the product, it actually would retail for $1,800. So there's lots of great product that comes with this for free. And all of the graphic design to make the card, that's all included too. There's no setup charges or anything like that. So if we look at what this guarantee means, in a bundle of 3,000 cards, you're going to get 3,000 total. 1,500 of them are going to be the presentation cards. And just mind me for 1 second while I flip back through here. I want to show you what those presentation cards are. It's been a little while since we saw them. That's the little kind of thank you card, and it comes with an envelope. Those are the ones that you can go ahead and send back to that inactive file and reactivate some of those patients. So half of the cards will come with that envelope card feature. And in the case of 3,000 cards, Viva is absolutely guaranteeing you that you're going to get a minimum of 2% return, which means that if you distribute 3,000 cards, we will absolutely guarantee you that you'll have 60 referral patients in the practice as a result. Now, you guys have been in business for 30 years, so you're probably very familiar with this. If you were able to give word-of-mouth new patient opportunities, 60 of them, to your dentist, how many of those would he be able to convert into actual patients?
Yeah, I don't know. I'm fascinated by this whole idea. So I'm not sure. I'm the marketing person in the office, so I go to each of these dentist offices, and I could see the potential for handing out these cards, and, you know, I could see how this could work to really just bring people into the office.
Yeah, and the one thing that I love is, and I've had a lot of these presentations now, and I hear from practices, and this is why I like to kind of present this live with an actual office. And Mary and I don't know each other. For the rest of you who are learning in here, we just met like 2 minutes before this call. But the fact that you're going to get 60 guaranteed people coming in your office, it's not like the same 60 that are coming in off a magazine or a Groupon or anything like this. Remember, this whole premise is that your friends and family are giving you these gift cards. Your staff is giving the gift cards. This is a hand-to-hand, please have this card on behalf of my dentist kind of person that's showing up in your office. So it is a word-of-mouth patient, and 60 word-of-mouth patients is far more valuable than just 60 random patients that come in for a new patient exam. So it's a very, very incredible thing. Now, when we looked at the live charts, we saw that Glenwick was operating at over 5% return. 5% return on 3,000 cards is actually 150 patients in the office. So if you were to walk along this line, the guaranteed acquisition, so how much do I pay to get a patient to come in and see me, on the guarantee, in this particular case, if we only got 60, that would be $67 a patient. Certainly a lot different than what I've been hearing, you know, the direct mail piece made it so I had to pay $300 for each patient that came in to see me. And of course, the potential revenue is going to be different for each one of your practices, because a new patient revenue in the ortho office, you know, can be $3,000 to $5,000. The new patient revenue in a dental practice might be $500, but you can see how you can translate that. And if you're getting those referral opportunities, those patients coming in as a result of referral, you know, most doctors are finding that they're going to close a large percentage of those 60. I'm sure not all of them, although I'm sure all of you are delightful and excellent practitioners. But definitely, you know, 70 to 80% of them, because they're very, very qualified leads. So to be able to translate, you know, $39.95 to guarantee yourself 60 opportunities at new patients at a minimum as a guarantee really creates some wonderful things in the office. So not only do you get the guarantee of the new patients, but you get to track where those new patients are coming from, which helps you with your staff being productive in referring. It helps you with patient referral programs so that you can gift that person. You can know exactly how much money, you know, Rebecca from down the street has actually referred to you. You can know exactly how much revenue the general dentist down the street has referred to you. You can track all of that real time, minute by minute and day by day, and keep your hands on your marketing intentions and where you're putting these cards and where you're getting the success from. So it's a great way to manage the whole program. And we've actually seen some of the larger, a couple of larger chains who have worked with the Viva cards and have actually dropped all of their marketing strategies because there's just nothing that's giving them the return like this anyway, and they can track every single card that goes out and comes back in. So it's a great way to keep your hands on the whole process. So basically the question to all of you is, how many cards do you need? What questions do you have, of course, is very key. And if you have any, Mary, at this point, that would be great. If you have, you can certainly ask them to me live. Tonight, go ahead.
Well, no, you go ahead, and I do have questions.
No, go ahead. You can. Mine is at the end anyway, so go ahead.
Oh, okay. I'm wondering if there is a way to have this presentation on paper or some way that I can present it to the doctor and our staff.
Yes, I will have Gwen follow up with you on how that can get given to. I will make sure that she gets a presentation to you, and I'm going to have for all of you on the call. We're actually going to, if anyone is interested in putting an order together this evening and just deciding on a number of cards, we can work out the offer with your details later. But we are going to kind of throw an extra bonus in besides the whitening product that we're going to give you. On the 1,000 card level, we're going to throw in an extra 50 cards. On the 3,000 card level, we'll give an extra 100 cards. And on the 6,000 card level, we'll give an extra free 200 cards. So there'll be an extra promotion. What we'll do is if anyone wants to reply to this specific email, which is mine, I'm the Director of Sales here. I will, of course, distribute, in your case, it would be to Gwen, Mary, the account and the requests and the questions and whatnot to your assigned people that are working with you. And if you don't have anyone assigned, we'll get one to you. But if you want to reply to this email and put in the webinar and the date, that will get you that special, which is an extra card total for you, 50, 100, and 200 respectively with the packages. So does anyone else have any questions? You can type the questions in there, and I might be able to actually see those questions. While you've got my attention live, you're more than welcome to contribute and ask. Anybody out there? And thanks again, Mary, for being my live demonstrator. It helps to kind of walk through the process really with an actual practice and actual numbers and help the whole thing make sense.
Yeah, that's my pleasure. Thank you.
I really appreciate it. And if anyone else has any specific questions, please feel free to email me. I'm actually in the office for a long time this evening because we're doing these presentations kind of 10 practices at a time at the moment. We're having a very difficult time keeping up with the demand. So we would love to get you in the queue for your cards. Typically the turnaround time, once you have approved your design, which usually just takes a couple of days, once you've approved your design and your offer, you're going to get your cards in about 10 to 12 business days. It doesn't take too long once everything gets done graphically, and you'll be able to go ahead from there. So,
I have another question.
Sure, please.
Once, if you started out and you handed out all of your cards, you just keep reordering the cards and it just is a continual process?
Absolutely. Absolutely. A lot of people ask me that. That's a great question. They say, well, how long are the cards supposed to last? And it really depends on your practice, because if you're giving 2 to every patient that exits the building, then depending on how many patients you see a month, that's going to add up there. If you've got your staff distributing them, and that's even before you go out and create those business relationships or give the cards to the business relationships that have already been created throughout the years. So it's easy to distribute cards pretty quickly, to be honest. 3,000 cards, I think most people will go through in about 2 months with a practice of 400 or 500 patients a month. But what we're seeing is people are calling in to order cards a lot quicker than that, which is wonderful, because that means the cards are working and they're getting a lot better than their guaranteed 2% return. Just like we saw in the live Glen Lake, they're much more than 5. So it's, you know, when you're making money off of this and there's trackable results and you can like really do the math and add up the dollars, it's not hard to buy more cards when you need them.
Okay.
Yeah, so we're finding that you can order them basically as often as you want. Now, of course, as you know that they're working for you, you probably don't want to order them 1,000 at a time. You can get a little bit better, pricing as you go up the ladder. But, for some practices, 6,000 cards is very, very overwhelming. So it doesn't match every practice, but certainly, yes, you're just going to reorder those as necessary. And that free product, for now, will come with it each time.
Okay.
All right. Great question. Anybody else out there? All right. Well, if that's it, I will go ahead and close the session for this evening. If you do have any more questions, please feel free to email them directly to me, or if you have a designated marketing consultant already, reach out to them. In the next couple of days, if you're interested in this, definitely let us know on the quick so we can get you ahead of these big groups that we're presenting this to. We'd like to take care of our current customers as quickly as possible and get them at the head of the line, that's for sure. So please give us a call or send an email directly to me, and I will make sure all your concerns are taken care of. And if you put the webinar date in the subject line, we'll get you those extra free cards as well. Okay, you all have a great night, and thank you so much for listening to me for a few minutes. And hopefully we found a great way for you all to make some new patient revenue off some wonderful word-of-mouth patients of yours. Thanks so much, Mary.
Okay, thank you.
Okay,
it was a nice presentation.
Thank you so much. You have a great time, and I'm sure Gwen will follow up with you on that presentation for you, okay?
Okay.
Okay.
Okay, great. Yes, thank you.
Thanks.